Today I'm talking about the DAO, or the Depressor Anguli Oris. The DAO is a muscle situated in the superficial perioral region. The DAO on both sides can cause the mouth to pull down from the corners inferiorly, like this, causing us to look sad. This can result in a droopy, older-looking appearance. And the unilateral contraction of the DAO can actually make us look droopy, like we had a stroke on one side. In general, that droopy appearance can make us look sad or upset. For that reason, it's an area that we commonly treat with neuromodulators. There are many neuromodulators out there. None of them, as of yet, are FDA approved to treat the DAO, but it is a common practice to treat this area. An effective treatment of the DAO keeps the mouth from pulling down when they express themselves. The DAO dilates itself and depresses the oral commissures, like that. Prior to ultrasound, even though I have had the experience of multiple cadaver workshops, I didn't really understand the depth of the DAO. Now that I can scan patients, I can see how superficial, but also how deep the DAO truly is. Studies show from one person to the next, and depending on the location that the DAO is injected, the DAO can range from 0.25 to 0.7 centimeters from the skin surface. Looking at the anatomy of the DAO, a common point of reference is the modiolus. Modiolus is a convergent of multiple muscles at the superior point of the DAO. It's a thick, muscular band intermingled with the converging fibers around the chalaen. It consists of the zygomaticus major, DAO, levator anguli oris, buccinators, orbicularis oris, and risorius muscles. When a patient contracts the DAO, you can also feel the modiolus and the thickness of that whole region at the corner of the mouth. The modiolus is a common reference point when we're looking for the DAO and where to inject it with a neuromodulator. Aside from palpating this area, you can also image it with an ultrasound, and this way you look at the patient's unique anatomy and you can see the depth of that muscle. The injection point that I like to use is just inferior to the modiolus. Ultrasound guided injections into the DAO actually give you the exact reference point of where to inject. You can use general rules or palpate, but looking at general rules or where you last saw a DAO on a cadaver, that may not exactly be where the DAO is from one patient to the next. When you think about a cadaver, first of all, the tissue isn't the same because it's not a live model, and it can vary from one person to the next. Also, that cadaver could be decades older than the current patient that you're treating. All of those mean that there are going to be variations in the location of that muscle. For general reference, and without the use of ultrasound, we look at common depths for the DAO, and one study I looked at suggested that injection depth should be 6 to 7 millimeters deep. Looking at the ultrasound image that I included here, you can see that that would be a fair depth to effectively treat the DAO. What do you think about this? I've seen others inject the DAO very superficially, actually intradermally. In looking at this ultrasound image, how effective do you think an intradermal treatment will be? Do you think enough of that neuromodulator is actually being absorbed by the muscle? Yes, dosing of the DAO is an important factor. We want to make sure we don't underdose the patient and therefore it wears off too quick. But in addition, if we're not getting the right location or if we're injecting too superficially, there is a chance that not enough product is actually penetrating into the muscle. We're wasting product, and therefore the DAO treatment may not be as effective, and even if it is effective, it may wear off too quickly. So the image of this ultrasound of the DAO was taken 1 centimeter laterally to the oral commissure and 1 centimeter inferior to the oral commissure, just beneath the modiolus. Now that you've seen this picture, would you treat the DAO any differently? If you like this video, please like and subscribe and leave a comment of what you'd like me to record next. Thanks.